Hello everyone. Today we are going to see what chronic conditions we should code in ICD-10-CM while coding. So chronic conditions are nothing but long-term diseases that often progress slowly and require continuous medical management. These conditions don't have a cure because they result from complex interaction between genetics, environment, and lifestyle. While treatment can control symptoms, the underlying causes often cannot be reversed. So, in simple terms, chronic conditions are something which don't have a cure. Okay, so today we are going to discuss 26 chronic conditions and what code series we have to code. And these chronic conditions should be coded from the past medical history if they are not documented in the assessment. So let us see what 26 chronic conditions we are going to discuss in this list. There are more than these 26 conditions, but these are the main 26 conditions which we will be discussing. Let us see. So our first chronic condition will start from something which is very common and everyone know, that is hypertension. I-10 series we have to code for hypertension. So if we see in medical term what is hypertension, it is nothing but high blood pressure where the force of blood against the arteries of all the body is too high. There is no cure for hypertension till now. Only medication management is there, lifestyle management is there, and it is influenced by genetics and aging. So it cannot be eliminated completely from the body once hypertension is diagnosed. Second type condition is diabetes E08 to E13 code series we have to call. So what exactly it is in the medical terms? So it is a metabolic disorder where the body either does not produce insulin, that is type 1, or cannot use insulin properly, that is called as type 2. So for type 1 and type 2 there is no cure. Type 1 we develop in childhood, type 2 in adulthood. Type 1 also called as autoimmune condition. Type 2 is also insulin resistance. So third one is obesity. E66.9 series code we have to use for obesity. You can code it from the past medical history because if they lose weight also it will not be permanently lost. It will come back most of the time. So there is no permanent cure for obesity. There are genetic, hormonal, and metabolic factors making long-term weight loss difficult to sustain permanently. Okay. Fourth one is congestive heart failure. I-50 series codes you have to code. What happens in congestive heart failure is your muscles of the heart cannot pump blood efficiently to your body, and the muscles will become very elastic. There is a damage to the heart muscle that is permanent, requiring lifelong management. Fifth one is COPD, J44.9 series. This is related due to smoking and environmental factors also, like pollution. So it is a group of lung disease that block airflow and cause breathing problems. Why there is a no cure? Because once lung tissues are damaged from smoking or pollution, it is irreversible. We cannot reverse it. Sixth one is asthma, J45 series codes. It is diagnosed in the childhood, and asthma also don't have any permanent cure. It can be managed. Airways become inflamed and narrow, making breathing difficult. Also, as I said, there is no cure for asthma, only nebulizers are there. Okay, it is a type of chronic immune response to environmental triggers and genetics. Fifth one is emphysema. J43 series codes we have to use. So what exactly is emphysema? Emphysema is a form of COPD that destroys lung tissue, reducing oxygen exchange. Again, for this condition also, there is no cure. Lost lung tissue does not regenerate once it is lost. Smoking history also we have to code Z87, F17, F17 is for current, Z87 for past medical history of smoking. Why we have to code smoking? Because once our past history is there of smoking means lungs will be damaged due to smoking. Again, as I said, due to smoking only most of the people will develop COPD or emphysema, and the damage done to lung and arteries is irreversible. Ninth one is Alzheimer's disease. This is a disease of the brain, mostly in the old age people. So what happens in this disease is it is a progressive neurological disorder that affects memory and cognitive function. Again, for this condition also, there is no cure till now. Brain cell degeneration again cannot be reversed. So 10th one is HIV AIDS, B20 and Z21 series codes. You have to hold it. So as everyone knows that there is no cure for HIV and AIDS. It is a viral infection that attacks the immune system, and till now only medication management is there, no permanent cure is there. The virus integrates into human DNA, making eradication impossible with current medicine. 11th one is CKD. N18 series code you have to code, and there are five stages: stage 1, 2, 3, 4, 5, and ESRD. So again, there is a progressive loss of kidney function over time, and there are millions of cells in stage 1. In stage 5, there will be very less nephrons available, and damaged kidney tissue does not regenerate again. Then 12th one is deafness or hearing loss. H90 series codes you have to code. Deafness also don't have any cure. We have to code deafness if it is mentioned in the past medical history, either it is complete or partial hearing loss. It can be managed with some kind of devices, but still you have to code it. The inner ear structure damage is irreversible. GERD, K21 series code you have to code. Gastroesophageal reflux disease is also irreversible condition. The acid reflux irritates the esophagus. Again, only medication management is there for GERD, and the lower esophageal sphincter dysfunction is often irreversible. 14 one is thyroid disorder. E03, E05 codes you have to code for thyroid disorders: hypothyroidism, hyperparathyroidism, disorders affecting hormone production by the thyroid gland. There is no cure for all these conditions which I have mentioned related to thyroid. Thyroid function is permanently altered by autoimmune attacks or gland damage. So you have to code it. 15th one is coronary artery disease, CAD, I25 series codes. The arteries of the heart will be blocked due to plaque buildup, or narrowing of the heart arteries due to plaque buildup will be there. Either calcium buildup or fat buildup is there. Again, till now there is no permanent cure to the artery damage and plaque accumulation. Cannot be reversed. 16th one is stroke or CVA. So for stroke also, if once stroke occurs, there will be some kind of sequelas there, like limb weakness. Okay, so you have to report stroke codes that is from past medical history. There are Z series codes. Okay, brain cells affected by stroke again do not regenerate. 17 one is epilepsy or seizure or conversion. For this also, you have to check seizure disorder in past medical history, and you have to code it. It is a neurological disorder causing recurrent seizures in the patient. Again, till now there is no cure for epilepsy or seizure. The exact cause is often unknown, and brain damage cannot be permanent. Now moving to 18th one, anxiety F41 series. This is mental condition, and once anxiety is diagnosed, again it is a chronic condition, a mental health disorder causing excessive worry in the patients. Till now, there is no permanent cure for anxiety, and it is managed only with medications and group therapy. It is linked to brain chemistry and stress. 19th one is also mental disorder, depression. F32 series codes you have to code. So, once patient is diagnosed with a depression, it will be there permanently. It is a type of mood disorder with persistent sadness. Again, as I said, there is no cure. There will be some kind of chemical imbalance in the brain due to genetic or environmental causes. Then 20th one is osteoporosis M81 series. Once osteoporosis is diagnosed, the bones will become porous and hollow. The bone density loss will be increased, fracture risk will be increased, and again there is no cure. First, osteopenia will be diagnosed, then osteoporosis will be diagnosed. Bone regeneration slows permanently with age. Then 21st one is sleep apnea, G47 series. So sleep apnea, as everyone knows, patient breathing stops and starts during sleep. This is also a chronic condition. If it is diagnosed once, there is no cure for it till now. Airway blockage or brain miscommunication persists over time in sleep apnea. 22nd is fibromyalgia M79.7. So, if we see fibromyalgia is related to your muscles, a disorder causing widespread pain and fatigue. Till now, for fibromyalgia also, there has been no cure invented. The exact cause is unknown and nurse continues to misfire pain signals. Again, 23rd is bipolar disorder F31 series. This is also a mental condition. Bipolar means bi means two, polar means two poles. So patient will have two conditions at the same time. A mental illness with extreme mood swings. Sometimes patient will be full of happiness. Sometimes patient will be very much depressed. So two conditions will be there in bipolar. 24th is osteopenia. As I previously said, before osteoporosis, patient will develop osteopenia. Again, that is a kind of bone damage. Lower than the normal bone density will be diagnosed in most of the time in old age patient above 50. Usually, ladies are more prone to this condition. Again, that is due to aging and genetic causing progressive bone weakening. 25th is neuropathy. Neuropathy, as you know, sometimes it is related to diabetes, or most of the time it is related to diabetes, and the nerves will be affected. Nerve damage causing pain and weakness. Again, for this also, there is no permanent cure. Only medication, gabapentin, and etc. will be there. Nerve regeneration very slow and often incomplete. The last one is Parkinson's disease, G20 series. Again, this is also a type of what we call disease related to old age patients. It is a kind of neurodegenerative disorder affecting movement. Again, as I said, there is no cure for this condition also. So the brain cells that produce dopamine continue to deteriorate. Thank you everyone for watching this video. At the end, I want to tell there are more chronic conditions. We will continue to see them in the next upcoming videos. Please comment and tell me. This is my first video in the medical coding. I have almost more than 15 years of experience in medical coding. First time I am starting the YouTube channel. This is my first video. Please support me, comment and tell me what next subject video you want, and whenever you are coding the chronic condition from past medical history, you have to check few things, like not for all conditions, but like as I said, CVA, you have to check whether there is any arm weakness or sequela with CVA. So if those sequelas are there, you have to code them. And for obesity, sometimes they will do surgeries, bariatric surgeries to remove the obesity. So if it is done, then you should not code obesity. And sometimes with some kind of bariatric surgery, they will mention as diabetes resolved completely. So in that scenario also you should not code diabetes. Okay. Apart from these, all rest of the chronic conditions you have to code. Okay. If you like my channel, please consider for subscribing. Thank you very much. Have a nice day. Bye bye.